Hello everyone, welcome to my channel Dental Education for Students. Myself Dr. Sneha Naure, MDS Oral and Maxillofacial Surgeon. Welcome to my second part of the case history taking. In the first part, we have covered the personal data, the importance of personal data and the way of taking it. In this second part, we will be discussing about chief complaint, how to write history of present illness, importance of past medical history, my method of taking past medical history, past dental history, family history, and personal history. So, this all will be covered in part 2 of case history taking. So, stay tuned. Chief complaint should always be in patient's own word. No medical term should be used and it should end with a specific time period. For example, a patient told you that he has pain in this teeth region. So he is pointing on his right side. Also, he is telling you on the lower jaw and that too on the back side. So how you will frame a chief complaint? The patient complains of pain in lower right back teeth region, and the next question you will ask the patient is since how many days? Since how many days you have pain? If he tells you it is since last 10 days, last 15 days, 15 months, whatever it is, you are supposed to write that specific period. So your patient has told you he has pain here and it is since last 10 days. So how you will write it? You will write that patient complains of pain in the lower right back teeth region since last 10 days. That's how you should write the chief complaint. One important thing you should note down is that you should not involve any of the medical term while writing the chief complaint, such as anterior, posterior, any medical term such as mandible, maxilla. These terms should be excluded while writing a chief complaint. You should always write like if it is anterior, you should always write front. If it is posterior, you write it as back. If mandible, if the patient is saying mandible, you write it as lower jaw. If maxilla, you write it as an upper jaw. Okay, for anterior teeth, you can term it as front teeth. Don't use any medical term. History of present illness is elaboration of a chief complaint. Whatever the patient has told you in the chief complaint, now you are supposed to write the details in history of chief complaint. One thing you should note down that you should ask the patient the characteristics of the pain. What kind of pain patient was experiencing? There are multiple kinds of pain such as sharp shooting pain, dull and continuous pain, radiating pain, lancetting pain. Those all things should be noted down. In history of present illness, three things are important to mention. One is onset of the pain, second is the duration of the pain, and then the progress of the pain. Now, when it comes to writing an HOPI, how you should frame it is patient was apparently all right 10 days before, then he started experiencing pain in his lower right back teeth region. Pain was dull and continuous. It could be anything depending upon the patient, whatever he has told you. So in our case, we'll take an example of dull and continuous pain. Now, you should also mention the aggravating and the relieving factors. Now, what are aggravating factors? Aggravating factors like pain during chewing food, during having cold water, or also during occluding the teeth. Those things can be the aggravating factors. And which are the relieving factors? Relieving factors such as taking medication. Then few patient has a habit of putting glove on it, the tooth, which gives them relief for some time. But after that, again they get the pain. So you should note each and everything. So how you will frame it? History of present illness. Patient was apparently all right. 10 days before, then started experiencing pain in lower right back teeth region. Pain was dull and continuous in nature. The aggravating factor was chewing food. The relieving factor was taking medication. But still, the pain exists, so patient reported to a department. So it gives you an entire sequence of the patient. After recording history of present illness, the next come is the past medical history. In this, it tells you the generalized state of the patient so that no complication can occur during your dental procedures. So I have divided this topic into 5 points. These 5 points will help you to gain all the information. For past medical history, I have divided it into 5 topics. These are the 5 topics. In that, the first is the medication. Whenever you record a case history, ask the patient about the medication. If he knows the name of the medication, note it down. If he doesn't know the name of the medications, ask him, are you carrying any prescription paper of the doctor who has advised you this medication? See for that, note it down. Or else you can also ask for the strip of the medication if he has, or any notes where he has been advised these medications to be taken. You can note it down that. See which medication it is. If you know the name of the medicine, it is okay. If the name is totally new, for example, multiple medicines or a particular drug has multiple other brand names, no worry. Just go on internet and search which medicine it is, what is the class of the medication, and it is been advised for which condition. Once you understand that, ask the patient that are you going through this, and because of that the medication is been advised. Yes, note it down. How many times a day you take it, and since how long you are taking it. Okay, so after medication comes the surgery. Many patients have undergone any cardiac surgery, any abdominal surgeries, or any cranial surgery. Just note down and ask them for how, when was the surgery done, how was the state, when, whether you were admitted in ICU or whether it was just a normal stay in hospital, how long was the procedure, was there any complication during the surgeries. So these things you should note down. Then comes hospitalization. You get admitted to hospital because of multiple reasons, because of COVID, because of dengue, malaria, and certain medications were started on you. What treatment was done, any complications you have faced, these things should be noted down. After that comes the drug allergy. Now, drug allergy is again very important, as you will be advising certain medication to patient after your dental procedure. So you should be aware that whether whichever are medications I am advising, the patient is not allergic for it. So ask the patient that have you suffered any allergy to particular medication. If he has suffered, he will tell you yes, these are the medications which I have suffered. Now there are certain patients who doesn't understand medical terms. So, for asking them about drug allergy, you should tell them the signs and symptoms of that. Now, what are the signs and symptoms? One is rashes, itching, excessive sweating, palpitation. So, if the patient has suffered from any of these signs and symptoms, he will tell you that after consuming this particular medicine, he has suffered from these signs and symptoms, and just note it down. So, you will be aware while advising any particular medication. After that comes the systemic disorder. Patient have certain genetic disorders or any blood disorder for which patient is not advised on any medication or any therapy. But you should be aware before starting any dental procedure so that you do not have or face any complications on it. So these 5 points will cover the entire general examination or general state of the patient, which will come under the past medical history. After past medical history is the past dental history. Now, past dental history. It tells you about all the dental procedure patient has undergone. For example, extraction, restoration, prosthesis, implants. Everything should be noted down. As a surgeon, I always ask them about the complications faced during their last extraction procedure. For example, what you can anticipate is excessive bleeding during extraction, delayed wound healing, or any other complications like syncope or any other medical emergency. If patient told you that he has suffered from any of this, then note it down. What management has been taken during that time, that you should also ask. If patient tells you there was no complication, the procedure went very nicely, the healing was also good, during extraction also he did not have any complication, then you should mention uneventful extraction. Patient uneventful extraction of whatever teeth it is. Okay, so patient gives history of dental extraction which was uneventful, or any restoration or prosthesis that you noted down. Personal history, you can ask the patient about their brushing habits or any deleterious habit. For brushing habit, you can ask them how many times he brushes their teeth, like once or twice a day, or what kind of technique do they use. Now, when it comes to deleterious habit, any kind of addiction does the patient have, like tobacco, alcohol, smoking, betel nut chewing, or erica nut chewing, or mishery product. In India, many females have this addiction of mishery shaving, where they use the mishery to clean their teeth, and that's how they get addicted to that product. Now, when the patient tells you he is being addicted to a tobacco, just simply ask them for how many times a day he uses a tobacco, what kind of product he is using, and since how long it is using. Now, why all those things are important to ask about addiction? Because you are going to do certain procedure, certain dental procedure on the patient, and if you are unaware that patient is using tobacco, or he is still smoking or consuming alcohol, it will change your follow up, or it will cause any complications for healing. Like if the patient is still chewing tobacco and you have done an extraction, it will lead to delayed wound healing. Okay, then you have placed an implant and the patient is still smoking, so there is adverse effect of smoking on the implant area. Then also certain drugs have an interference with the alcohol. So once you are aware that patient is being addicted to this certain product, I will be aware when doing a dental procedure. I will be counseling the patient first to stop all this addiction. Second thing, at least during my procedure or after my procedure, he should not consume these things because it will affect the healing. Okay, so I am assured that I have informed the patient that your addiction might have an adverse effect on our treatment. So my main aim is to inform the patient that these things are not good for your body and you should stop it immediately. Okay, so that includes in the personal history. In family history, there are certain inherited anomalies and abnormalities, such as congenitally missing lateral incisors, ectodermal dysplasia, amelogenesis imperfecta, cleft lip, cleft palate. Also, genetically transferred diseases such as asthma, cancer, diabetes, hypertension. So, if any of the patient parents or siblings have certain diseases, you should note it down in the family history.